Hafaday, welcome to Independent Guåhan's April General Assembly. Before we get into our presentation, we always like to start by singing the Inifresi. So if you'd like to sing along or read along from home, we're going to listen to a version of the pledge in song by Zach Guåhan.
So glad that I never had that feeling. Our land. Here we go now, here we go. Here among the music, here we go now, feel the flow. It must not kill it. That's so good. It must not color. It so good. That it must be good. Pressing my settle. If I protect and defend it, cultura, lenguaje, mano. Zanitano Tamoru, yes, yes, yes. Zanitano Tamoru, yes, yes, yes. Me even Shaku. Did it to get into Stata? 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 What fit my hilo? Dani Biblia, Ibandera Guåhan, yes, yes, yes. 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 Ibandera Guåhan, yes.
For your beautiful rendition of Inifresi. Welcome everybody to the April General Assembly for Independent Guåhan. Guahu si Victoria Lola Leon Guerrero. I am the co-chairperson for the Independence for Guam Task Force and the co-chairperson for our Educational Development and Research Committee. Today I'm also joined by my fellow chairs, Dr. Michael Lujan Bavacqua, who is also the chairperson of our media committee and is helping us go live and just sort of handling a lot of our technical needs for this presentation. Sizos Masi for joining us. We're also joined by the co-chair of Educational Development and Research, Dr. Francine Napati, who will be doing our Hita Latman presentation this evening. We are very honored to have Senator Amanda Shelton with us today, who will be telling us about the life of her grandmother, also named Amanda Shelton. And we're joined with educator, community organizer, and very talented writer, Shannon McManus, who will be, Shannon Dispensa, so she has a wonderful sister named Shannon. These McManus girls are amazingly talented, and we're so blessed to have Shaban McManus presenting with us this evening. So welcome everybody. We're gonna jump right into it. We're going to be looking at lessons we're all learning about sovereignty during this pandemic. And this really falls in line with a lot of the goals of Independent Guåhan. Our role has been to educate our community about the possibilities of independence. And during this time, more than ever, we see how necessary sovereignty is. Community organizer and very talented writer. There's a lot of the goals. Oh, something is happening. Sorry, technical difficulties on my end. Sorry about that. So Independent Guåhan's main goal is to empower the Chamorro people to reclaim our sovereignty as a nation, inspired by the strength of our ancestors and with love for future generations, we educate and unify all who call our island home to build a sustainable and prosperous independent future. And so Independent Guåhan is a larger organization that supports the role of the task force as part of the Commission on Decolonization, which is to educate the island about the possibilities of independence, but also the need for decolonization. We do this in many ways, and every month we host a General Assembly like we're doing today online. Typically, we host our General Assemblies at the Chamorro Village, but since the stay-at-home order, this is our second online General Assembly. And right before the stay-at-home order started, just that weekend, we had actually led a hike to Litexen as part of what we call our Haleta hikes, where we bring people to cultural and sacred sites to learn more about our history and also to help care for these spaces that mean so much to us. And that are part of who we are. And so these are some photos from our most recent Haleta hike. Also, since we aren't able to do as many of the educational events we typically do in the community, a lot of our efforts have really moved online. And so we have a weekly podcast that's had over 100 episodes called Fanatsu, and you can find Fanatsu on Facebook. It's run by our media committee. So the co-chairs are Lawrence Lazama and Dr. Michael Lujan Babako, and we hope that you will tune into Fanatsu, listen to past episodes. We most recently had an episode focused on Palau, which we'll also talk a little bit about today. So please definitely tune into Fanatsu. So without further ado, we'd like to get right into our presentation. Every month at our General Assembly, we pick a topic of importance to our community, and we honor somebody in our island's history that we can really learn from, that really left lessons about decolonization for us, but also capture for us who we are as a people, and from their lives give an example for who we can be going into the future. And so we call this our Maga'taotao series. And today, for as part of this series, we'd like to honor Chamorro nurse Amanda Guzman Shelton. And again, I'd like to welcome her granddaughter, Senator Amanda Shelton, to talk about her life.
Thank you very much for that introduction, Victoria. Hafaday, everyone. Studios Masi to Independent Guåhan for having me here today, and most especially for choosing to honor my grandmother for today's General Assembly. I'm Amanda Shelton. I'm the youngest of 4 grandchildren of Amanda Pangilinan Guzman Shelton, and I believe my siblings are all tuned in as well. My sister Melinda and her family are in Oregon. My sister Madeline and her family are in Florida. My brother and his family in Sinahanyan. So on behalf of our family, Studios Maga'taotao. Now, I never really knew my grandmother. I never knew my grandmother because she passed away almost a decade before I was born, but I am her namesake, so I'm very honored to share a little bit about her life today. When I was growing up, I only knew a handful of things about her, and that was that I was named after her, that I look like her and I was tall like her, where she was buried at Pigo Cemetery, and that she was a nurse, and my parents wanted me to be a nurse like her. And so it wasn't until maybe middle school where I asked my dad a little bit more about her and what she was like and about her family history. And that kind of started to teach me about what an interesting and fruitful life she had. And then it was just several years ago when the late Senator Tony Blas interviewed me about my grandmother and shared with me some of his research he was doing for Guampedia at that time. So that really helped uncover a lot of things for her and showed me what she was actually like. So she was born in 1906, and she was one of 9 children of Francisco Pangilinan, or of Francisco Guzman and Emiliana Pangilinan, and she also had a twin sister. People called her Mac, and later on in life they called her Tan Mac or Auntie Unda, and which is also the nickname that I grew up with, Unda. And she was, known from a very young age to be committed to helping people, and she knew that she wanted to be a nurse. She was very attracted to the nursing profession after she saw her aunt, who was hospitalized at the Naval Hospital, and how different nurses and doctors were helping her aunt, and how the staff and the nurses were very compassionate, and that's what she wanted to do. And so she had an opportunity several years later to join the Naval Hospital Nurse Training Program. And I think her parents were kind of against it at the time. She was only 16 years old, and to be in this nurse training program, it was like going to boarding school, so she would have to leave her family. And finally, her parents relented and allowed her to join. And she really desired to wear that iconic white nursing cap. I think you can see all of these ladies in the photo. They're all wearing these nursing caps, and that was the uniform of the day. And it was really unheard of at the time for a young Chamorro woman to go out and to have a profession of any kind, let alone a medical profession. And so it was unheard of. And so that's why her parents were very hesitant. But she received their blessing. She went to join the program, and she was under the supervision of the first chief Native nurse, Maria Roberto, who she was very fond of and very close to. And as a nursing student and as a young nurse, her responsibilities were to attend a few classes, to make patients' beds, feeding and bathing of patients, and to distribute medicine. A few years later, in 1934, she became the chief Native nurse, and she served all throughout the war during the Japanese occupation and up until 1948. So she held that title of chief Native nurse. She was one of two Chamorros who became the chief Native nurse. And she was known to be very confident, caring, authoritative, influential, stern, and strict, and just a very serious person all around. And she was also always pushing young women to go after the nursing profession as well. She helped to mold a whole new generation of nurses for the island through this program. So she was in charge as the chief Native nurse to watch over the students' quarters, to teach and to supervise their patient care. She was also looked to be as a strict parent for all of the nurses in the program and all of the nurses who were under her supervision. They had to work very closely with Navy nurses and Navy doctors. And so she had to watch out for them to protect their integrity and their reputations as well. She was the chief Native nurse again during the Japanese occupation, and they were not released from their position at that time. And so they had the Japanese soldiers who were on island prioritize their health above the Chamorro people. And so this led many of the Native nurses to sneak out supplies and food so that they could help the local people. And she was in charge of all of these supplies and food, of course, as the chief nurse. And so I read in her history, in the research that's been done about her, that she and these nurses still wanted to provide for our people and did what they had to make it happen. And I'm sure that during this time, it was extremely difficult to be a Native nurse, to be working during war, and to be putting her life and the life of many other nurses at risk to take care of them. So it was a difficult time, but my grandmother was able to open the door for Native women to seek out careers beyond the home. She believed in herself that she could go out and make this living, but she also believed in them and showed them their potential in not just moving into a career, but moving up in her career as well. So after this position as chief Native nurse, she retired in 1948. She got married to my grandfather, Austin Shelton. And in 1949, when my grandmother was 43 years old, she had my dad, who's the late Sonny Shelton. She helped to run their business together, Shelton Music Inc. And she was no longer working in a hospital or officially as a nurse, but she was still a patera, or what is known as a midwife, for all of her neighbors in the village of Hagåtña. So the qualities that she had while serving as a chief Native nurse, being very authoritative, stern, strict, influential, caring, all of those things from her nursing career, her formal nursing career, she carried on with her while still continuing to help her community. I've had countless people tell me that my grandmother delivered them as a baby in their home somewhere in Agana, or that she nursed them when they were sick as a child growing up, and that there were lots of little girls who would go to her house. She'd also pierce their ears and just do all of these things, caring for the children. And she quickly became very close to all of the mothers around her, and was asked to be the godmother of many, many children in the village who she helped to deliver. And so she was also a tetsa, a prayer leader. And so people have shared with me that she was there at the beginning of their lives. She was there to bring them into the world, but she was also there to help families say goodbye to their loved ones, to lead the rosaries and the prayers in the community. And she'd go daily later on in life. Daily, she never drove, but she had a brother who would drive her around, and he would take her daily to make her visits to the priest and to her relatives. And they owned Shelton Music Inc., which was a coin-operated business. So she always had rolls of quarters with her. She'd bring these rolls of quarters and cartons of cigarettes, and she'd give them out to the priest and check on them and check on all of her relatives. And my sister told me that she remembers as a little girl being driven around by our uncle with my grandmother in this car and going to visit different relatives who were also sick. And my sister would go and play with the cousins or her friends, while my grandmother would go and care for our sick relatives. And so she was doing that even beyond her formal nursing career, still caring for others. And that was really a nice, consistent theme of her life that we are very proud of as a family. I never really reflected on that or about her life as a nurse, especially being a nurse during a time of war. And she must have faced so many difficult moments, I'm sure, and had to act with courage and stood resilient to lead the other nurses and to care for people who were occupying the island, as well as still continuing to think about her people, her Chamorro people. So courage and resiliency, for her and for her profession and for all of her colleagues. And that's a common trait that I see throughout our Chamorro history, in the face of whatever adversity it is, whether it be war or natural disaster or fight for self-governance or decolonization, or now in the midst of this COVID crisis, we have these different figures who have led us and who help us to continue to rise above. So many of them we talk about often and many we don't. And today I'm really honored to be able to talk about my grandmother as one of these people. But that courage and resiliency is really something that we exhibit as a people. And it's something that helps root us in a sense of hope. And that's a sense of hope that we need during this time. And pandemics and catastrophes can test the character of a community, but we can draw on this resiliency as a people, this hope as a people, and move forward. And, like other indigenous communities or communities that share a history of colonization, there's also a history of disproportionate levels of access to healthcare. And so something that we are experiencing right now, strained healthcare systems, which make this COVID-19 crisis even a little more stressful for all of us here on Guam. So we have survived many things. We've, come out of many things. And so I know that we'll come out of this as well as an even stronger community. But I'm really happy today to draw this connection from my grandmother and Native nurses during the time of the war to current nurses and healthcare nurse workers today. I put up a slide of these healthcare nurses and workers and this sign that's thanking our heroes at GMH because during the moments where Native nurses were serving during war, they were showing, love for their people, commitment to their people, even when they were in danger. And here we have our nurses and our doctors who are also fighting a different kind of battle here, fighting this COVID-19, and who are still able to show this love and commitment to our people. And so I'm really thankful for them. I'd like to, give them a big shout out for continuing to work tirelessly for all of us. And we have these talented group of individual, our homegrown nurses and doctors who are really mobilizing all of this care for us in our community to keep us healthy and to keep us safe. So a big thank you to them. And again, thank you very much to Independent Guåhan for for allowing me to speak a little bit and for honoring my grandmother today. I think you're on mute, Victoria.
I dispense a zoo. Sizos Maasi, Senator Shelton, for sharing your grandmother's life and for continuing her legacy and serving our people. We're going to transition into the next portion of our presentation called Hita Latmun. Hita Latmun really roughly translates into it's up to us, right? It really is our decision, kind of how we want to live our lives. And we feel that this really captures the essence of independence. And so every month we tackle a different issue that really helps us reflect on what would we do if it were up to us, if we were able to have full say in all decisions in our life. And so this month especially, we wanted to take a look at what are we learning about the need for sovereignty during this pandemic? And I'd like to welcome Dr. Francine Napati, who will be doing this portion of the presentation. Hafide, Dr. Napati.
Buenas, Hafide Toru Hamzo, and thank you for joining us tonight. Thank you all for staying home and logging on to Facebook just to hear our presentation. And so before I start, I really do want to preface this whole topic for this month. It's really unique in that this situation is constantly changing. A lot of our nations are responding to this minute by minute because the pandemic is forcing them to do that. The only countries that really had a lot of response plans already in place were Asian countries where they were impacted by earlier coronavirus pandemics. So when they were going through SARS, like places like Singapore already had sort of this map of what to do should this occur again. So first, what I wanted to do is really highlight how our territorial status really does impact how our government leaders can respond to Guam's healthcare needs. And after all, this is independent Guåhan, and one of the great things about independence is that it really is a blank slate in many ways. And so the pandemic itself is forcing us to kind of work with a blank slate. A lot of us don't have experience with this. A lot of us don't, many of us don't have immunity to this now. I mean, we're still trying to figure out if immunity is even something that people who have had COVID and then turned around and recovered are getting, and that's why they're doing things like the antibody tests. But independence does show kind of how much flexibility a nation can have in terms of its response. So first with the United States. So as a whole, what we're starting to see is there are many inconsistencies in how the pandemic's handled. Each state is responding in different ways to the pandemic. And for many of you who follow major news outlets, what we're seeing is that President Trump right now is basically battling it out with many of the states individually. He's trying to prompt a lot of the states and tell them, hey, it's about time to reopen because the American economy is about to come into a collapse. It's starting to turn into this downward spiral. And a lot of states are pushing back. They're saying, we understand your concern with the economy, but unfortunately, there's kind of a lot going on with our communities. We're seeing a rise in cases and we just don't feel that it's safe. And one governor, I mean, one that a lot of us have heard about recently is New York Governor Andrew Cuomo. New York has been hit the hardest in terms of the states. We're seeing cases that are happening in almost 100,000. I believe it probably surpassed that by this moment. And so what we're finding is, I mean, New York is a financial hub. If that state shuts down, you're going to have a lot of people, you're going to see the stock market start to go down, and a lot of people have their retirement funds in there. And so as a result, what you're seeing is that Governor Cuomo was like, I'm sorry, but we can't reopen despite the fact that you would like for us to. And so the New York Times, when they were reporting on the pandemic, they had said the orders or lack thereof. And when they say lack thereof, they're talking about the federal government, have divided the American public. In a handful of more rural states, Arkansas, Iowa, Nebraska, North Dakota, and South Dakota, governors held off on imposing stay-at-home orders. So they're actually not demanding that their residents stay at home. They can actually go out if they want to. They're also favoring other restrictions amid intense pressure to take stricter action. And that's not uncommon. So on the next slide, you're going to see a graphic that came from the New York Times showing that each state was just kind of responding on their own timeline. So if you see in that first picture, March 23rd, this is already when Guam's been a week into our lockdown, because our lockdown started March 16th. So only 9 states had stay-at-home orders. 3 days later, it increased to 21 states. That's still less than half of the United States overall. And then by March 30th, it was only 30 states who were accomplishing stay-at-home orders. And the thing that's incredibly frustrating with the United States is that we know they have a very advanced healthcare system, but unfortunately, even as this pandemic was happening in places like Italy and Spain, and we were seeing these really horrific news pieces coming out of those places, the United States had yet to have these cases come up. And then slowly over time, like maybe 3 weeks later, you start to see the number of cases in the United States trickle up. And then eventually they just completely surpass the rest of the world in terms of positive cases. So when interviewed, Dr. Fauci, a lot of you know him, you see him in the news all the time. A lot of people joke that now we're finally listening to epidemiologists, but he mentioned that each state is being hit in different ways. And he mentioned that because of this, it's almost like California itself is a country. It's acting as its own independent country. It's like New York is having to act as its own independent country because it's hard for them to have this relationship with the federal government. He continues that in this case, it really is a marriage between the federal government as the facilitator and the supporter. That's really what they're supposed to be doing, is helping states deal with this. And so what's really happening is that the real action is happening just at the state and local level. And unfortunately, because of our territorial status, this is a marriage Guam has mostly been left out of. We're a territory in the middle of the Pacific. So the United States is going through a lot right now. They don't necessarily have to pay attention to us. And so one thing that we're seeing too is other territories, so places like Puerto Rico. So Puerto Rico, what they tried to do is they tried to actually deal with this very early on, as early as Guam was doing. So in March 2020, Puerto Rico's governor actually wrote a letter to the FAA, so to the Federal Aviation Administration, and they said that they wanted to shut down their airport. They said, we want to have stricter screening. We want to make sure that our cases are not coming in, because like in places like Australia, they were finding that about 1/3 of their cases were coming from people entering the country, as opposed to it being a community spread where everybody was just kind of giving it to each other. And so when Puerto Rico tried to get the FAA to do this, the FAA just simply responded and they said, you know, in general, FAA policy does not permit the closure or restriction of airports that receive federal funding. They're like, any request to restrict or close an airport must be approved by the FAA. So they didn't hear very much after that. And so Puerto Rico tried again after a month, earlier in April 9th, actually was the date. The governor asked again. They said, hey, you know, since you're not allowing us to shut down the airport, why don't we kind of amend it a little bit and maybe lighten the restrictions and just stop flights coming from US hotspots? So for the states that are getting hit the hardest, can we just stop those flights? Because we know a lot of their people are COVID-19 positive. And I believe at this moment, they're still waiting for an answer. So it's showing us that our status as a territory is really limiting the kind of response we can have. And this was something Guam was trying to do very early on. A lot of people were very critical about the fact that we were still getting flights coming in from China, and they were trying to see if we could shut down the airport. But unfortunately, because we're a territory and we receive federal funding, the FAA has to be the one to give the order to shut down Guam's airport. And then another one, this was a very big case. I mean, this one went global. This was reaching all major news outlets. Is one way we've kind of seen this separation between Guam and the federal government was the USS Roosevelt. So the Navy was livid when Captain Cozier's letter went public, right? It wasn't meant to go public. And the reason why the Navy was pretty livid was because they felt that it compromised national security. It was stirring quite a bit of controversy that it even got to the point where the acting Secretary of the Navy eventually got fired because it was publicly broadcasted that he had called Cozier stupid and naive. And so what ended up happening is, so the USS Roosevelt was coming from Vietnam. They were leaving Vietnam, which is where they were docked for a bit of time, and they were making their way through the Philippine Sea. So of course, if you look at this map here, if you look at the Philippine Sea, Guam is one of the few territories kind of in this region. We also have the freely associated states. And then you have independent Asian countries. So the most logical place to dock a ship like that would be Guam, because we're US soil, the military already has a base here. They don't have to talk to the local government necessarily to get their ship here. And so this became pretty clear because a lot of community groups were a little bit hesitant at first, right? They were wondering what this would do to have COVID positive people dock onto Guam shores. They were worried about what kind of healthcare capacity our island would have. And I mean, thankfully, the Naval Hospital has been able to house these soldiers. A lot of the way the sailors are getting taken care of in our civilian hotels is that the Joint Region Marianas are the ones taking care of them. But at first, Governor Lou Leon-Guerrero, she kind of wanted more information. She was like, we want to know what's going on before we allow this, because I don't want this sort of widespread of coronavirus happening, because right now we've managed to keep it in pretty good order, right? We don't have that many cases. We have days where we don't test positive. And then another thing that was initially frustrating with the USS Roosevelt is that they weren't very open with the number of sailors who were positive, right? It took quite a while for these numbers to even come out. I think we were seeing in the news like maybe 2-3 days, we were still waiting to hear how many of these sailors who were coming onto Guam shores were actually COVID positive. And so Governor Lou Leon-Guerrero, when she was interviewed, she said, we have an interest in protecting our community and stopping the spread of COVID-19, just as much as the military has an obligation to return the USS Roosevelt to the open ocean to protect Guam and the region. So it wasn't that we didn't want to be hospitable and we didn't want to kind of help these sailors, but at the same time, she didn't want to turn around and compromise the health of the sailors and the health of the local community by in turn exposing us and the sailors to each other. Because anytime you have something like this, you really do want to stop travel and kind of stop people from interacting with one another so that you don't end up having this sort of widespread of COVID-19. And so Guam, for the most part, I want to kind of pay a lot of attention to the positives that have been happening. Guam, we've managed to keep our rates really low. And a lot of the reason why is that essentially Guam has been acting like an independent nation in and of itself. As we saw earlier with that New York Times graphic, when only 9 states were locking down on March 23rd, we were already a week into our quarantine. We were sure, I mean, Guam, if you look at us in comparison to other nations, Guam has probably had one of the longest lockdowns. We're going now into week 8. And that's quite a long time. Some countries are now planning to reopen. And for Guam, we're still talking about that. What is that gonna look like? How are we gonna reopen and how are we gonna help our small businesses? And so one thing that's been really kind of a learned lesson and best practice is that clear communication seems to be what's happening in nations that are doing really well. And so when BBC News was they were looking at New Zealand. So New Zealand's had a very, has been very successful in flattening the curve and keeping their rates down. And so they were saying that the government has also been praised for the clarity of its messaging throughout the crisis. And I think when you hear your prime minister deliver sensible information in a calm manner, that also helps you feel calm. And for many of us in Guam, we've had a very open sense of communication with JIC constantly giving us daily updates on how the island is doing. We had very early on in the lockdown, we had the governor's office in Adelup giving these I think 1 to 2 hour long press conferences so that people could come in and ask questions, especially amidst all this confusion and chaos. And so with New Zealand, they were very clear that that's what needed to happen. I mean, one of the reasons why the United States is getting constantly criticized about the way it's been handling COVID-19 is we all heard the infamous sort of statement that Trump's been making about ingesting disinfectants, right? states were saying they were seeing upticks in their hotlines getting called and people asking like, hey, can I do this as a way to prevent COVID-19? And then Trump later on had to retract his statement and say, oh, in actuality, I was being sarcastic. I didn't mean that. And, you know, he's the president of the United States. So it's not, this is a very serious issue. That's not something you should be joking about, especially on a platform like that. It's not something you should be sarcastic about for fear that people will misinterpret it. So even though Guam's been doing well, I mean, in many ways, our territorial status has kind of drastically limited what we've been able to do. So right now, one of the topics that the government itself is trying to handle is unemployment. We're now seeing, like I said, Guam has had a very long lockdown. And so a lot of people are now trying to get access to the CARES Act money that Guam was promised. They're also trying to get access to money that's supposed to come through unemployment. And so when PNC News was talking to Governor Lou Leon, they had announced that the IRS had approved Guam's estimation for economic impact payments to be paid out in the amount of $134.8 million. And so they were saying, though, that Rev Tax first needs to work with the IRS to finalize a plan. So as a territory, the reason why that's been such a huge issue is that we have the money's there, but we don't have systems in place to help those who lost their jobs and to allow them to seek unemployment. So one reason for that is we don't have an unemployment office here. So we don't really have a way to distribute it. So GovGuam right now is having to create its own portal, and none of this can really happen until the US Treasury approves this implementation plan. So it's really sitting with the Treasury, and it's up to the Treasury to decide if at any point it decides to address this. And because we're a territory, I imagine it's going to take quite a while because they are responding to the states first. And even once they approve this implementation plan, it's still going to take them about 2 weeks to get anything done. And so we have very limited capacity when it comes to doing this, unlike the states themselves who already have these systems in place. And so that's why if you read, a lot of states have already issued out unemployment checks to their residents. On top of that, the US states already have access to the IRS system. The IRS has this sort of database where they have everybody who's who's filed for taxes, and then what they end up doing is they get their checks as a result. Unfortunately, Guam, because we're a territory, our system's not as complete. We're also not connected to the IRS in the same way. And so Rev Tax is now having to scramble and create this sort of database for the IRS to even pull from before they can give out this stimulus money. States don't have to do this. And the reason for that is because in the Constitution, states are given certain powers that are reserved to them, right? So states can do this because the federal government isn't allowed to kind of impede on states' rights. And so they're not going to tell the states how to handle something like this. And then also in independence, this is something that Guam could have already had set up way beforehand, because we know that we have very high rates of poverty here in the island. And so of course, unemployment would be something that our government would want to address and want to make sure they have systems for. And so in moving forward, mass testing has also been a very large issue happening around this COVID-19. And so Germany, along with Great Britain and South Korea, have sort of led the way with large scale testing for COVID-19. And so Germany itself has been collecting nearly 1 million samples since the start of the crisis. And now the country has one of the lowest fatality rates compared to the rest of Europe. And so we're seeing that in the last week, nations and various states in the US are slowly starting to reopen. And the reason why they're able to reopen is that mass testing is one of the few prongs that needs to be in place in order for a place to reopen. And the reason why is because a lot of economics and health experts say that unless you guarantee to people that they'll be safe once they go out, the chances of them leaving their home are relatively low. And here in Guam, a lot of us suffer from diseases that make us immunocompromised. Many of us are elderly. And so it's very scary for us. A lot of us don't want to see our grandparents and don't want to be around our elderly parents because we're afraid that if somehow we have COVID-19, we're going to pass it on to them. So of course, if we're not sure that going out and reopening our businesses and sort of seeing each other again face to face is going to guarantee our safety, chances are residents in Guam won't really do it. And another thing too that independent nations have been very successful in is contact tracing. So Guam does do this. The Department of Public Health and Social Services, they are known to give phone calls to people who may have come into contact with someone who is tested positive. And so New Zealand has decided to kind of ramp this up. They want to make sure that they can trace the disease. You're even seeing news about countries developing apps to sort of track where people are going and kind of when they're contracting things. So that way they can sort of pattern out how the disease is moving throughout the community. And so numbers would be manageable with the help of aggressive contact tracing, which the Prime Minister said has been scaled up significantly with capacity to make up to 10,000 calls per day. I mean, that's really incredible. Guam just recently started its mass testing pilot program, which will allow us to feel more confident to come out of lockdown when the time comes. And as of last night, our positive cases stand at 145, which is pretty remarkable, especially given that most of that number is already recovered. And really, for me, the reason why independence is so important is because as a territory, we're essentially responding to this with one hand behind our back. We're able to lock our communities down. We're able to keep our people in their homes and keep them safe. But now you're seeing the stress of not having an economy that's able to handle something like this. And the reason for that is because this money is available, but because of these federal restrictions and because Guam is a territory, we cannot give out the money in a timely manner. We're having to stop ourselves, make a plan, and then wait for this plan to get approved. As we also saw in Puerto Rico, if Guam was able to shut down its airport right around the time we were in lockdown, which was well before the rest of the world, we wouldn't maybe have had a lot of these cases coming in. And so for me, it's a very striking example of what independence can be. The pandemic has basically wiped the slate clean for a lot of nations, forcing them to really examine how they're running their governments and how they're responding to the needs of the people. And I remember when Dr. Cabrera and the Physicians Advisory Group brought out that chart showing what Guam would look like once we hit capacity. I believe May 20th was sort of this doomsday. It was really overwhelming. And it was very stressful and grim to see that. But as we're seeing Guam, because our government is acting in many ways like an independent nation in doing things without waiting for the federal government to give us the okay, we're seeing that Guam is having this very positive response to having our cases stay consistent and stay low. So next, I would like to introduce Siobhan McManus. She'll be talking about our model nation of Palau and how they've been responding to COVID-19.
Maga'taotao. Thank you, Fran, for that very thorough presentation. That was really helpful, even to contextualize this whole situation for me. So yeah, today I'm going to be talking about Palau's response to COVID-19 and how their sovereignty, their political status has really enabled them to maybe respond in a way that's best for their people. And we're gonna look at key immediate responses enabled by their sovereignty and key long-term recovery elements enabled by their sovereignty. Okay, so when COVID-19 was sweeping across the Pacific, one of the first things that Palau did, that also Guam did, right? They closed public parks and areas, hygiene precautions, etc. Much like everyone else around the world, those were like the general responses. Where sovereignty comes into play is that once COVID-19 was seen as a threat to Palau specifically, they were able to swiftly close their borders. And now, a month or a month and a half into our collective like lockdowns. Palau has still 0 cases. And so for a really small island nation that is usually maybe in other people's minds very vulnerable, because their economy is smaller, their government is smaller, the fact that they're still COVID-19 free can be a little bit perplexing to some people. But the fact that they have full control over their borders and they could say, all right, on March 26th, we can make sure that the last commercial flight comes in, and then after that, no more. As we learned just from Fran's presentation, obviously Guam struggled with that, Puerto Rico struggled with that. As territories, we don't have those freedoms. And that put us at a greater risk, because obviously if you look at the cases that happened in Guam, all of them initially started, right? Community transmission didn't happen until, like it didn't happen until we had international travel that brought the virus here. So Palau was able to swiftly close their borders. Testing, which is what we've been also talking about as a community. How come we don't have mass testing yet? Or how come, in the first couple of weeks, it's why are we only able to test like so many people a day? And obviously, right, testing kits are not free. You have to purchase them. And so Guam has to go through a very meticulous process for that. It has to be FDA approved kits, right? But for Palau, they were able to receive testing kits from their allies in Taiwan. And it wasn't a very difficult process. Taiwan being a really important ally and Palau's pre-existing diplomatic relationship with them, it swiftly was able to, they were swiftly able to, aid Palau in that process. And then looking at the economic impacts of unemployment, Palau, as we learned in the Finatsu podcast last week, they're also feeling the weight of just joblessness and kind of like the big economic impacts of this virus. It's not just a public health issue, it's a poverty issue. But Palau being able to lean on their diplomatic relationships with other sovereign nations as a sovereign nation themselves means that they weren't worrying about like independence and their status as a nation didn't mean isolation from all regular aid that they receive. So the Work Enforcement Act, for example, is funding that they receive from the US in order to mitigate the impacts of unemployment. Japan has helped fly in supplies to Palau during this entire crisis. And then Taiwan with the testing kits and swiftly providing those. Palau's size and scale and maybe perceived lack of resources didn't affect their ability to immediately respond to all of those impacts. So we're seeing that their sovereignty has really been helpful, that even for a small island nation, they're able to lean on their strategic relationships with other nations because they're on an equal footing with those nations. Now looking at the long-term responses, I personally wanted to highlight food security, market recovery, and also continued foreign aid. Because what we're seeing in Guam is not only do we have, like I said earlier, a public health crisis, we're also facing an economic one. And poverty and food security has always been an issue that we face as an island, but it's obviously exacerbated by a crisis like this. If you've seen on the news for Guam, like the lines for the grab and go meals, you have like thousands of people around the island lining up for meals for their families. And these are families that aren't, they're working class families, yes, but they're not houseless. They're not the houseless community. These are people who all of a sudden, can't provide like basic everyday needs. And we don't have the infrastructure set up to feed our families. In Palau, they're struggling, but they also have a subsistence culture that is still very much intact. They still fish and they still farm a lot more than maybe communities in Guam do. And that sense of mutual aid as a community that pre-existed before COVID-19 came to Palau is all of a sudden like really important. And what we're seeing here in Guam is that basically this question of what happens when the two biggest industries and the biggest money makers for Guam, right, tourism being one of those things, what if it collapses? What do we have as an island? And Palau had to ask themselves that question too, because the tourism market is Palau's only major market and economy. But the fact that they're not seeing an increase in houselessness and an increase in food insecurity, the fact that they're not dealing with those things at the same scale that Guam is, means that they're doing something, that they're set up for this in ways that we're not. And so the key lesson, I guess, from Palau's response so far that I wanted to leave with us all is this idea that what Tuti Shelton had brought up in his podcast with Fanatsu. When we think of sovereign small island nations, and when we think of the question of independence for Guåhan, it's often like, oh, well, what are we going to do? We're going to be left, out in the Pacific, isolated, vulnerable for other nations to come in and swoop in and, take advantage. But what Tuti was explaining in his podcast as an educator in Palau, sovereignty is not isolationism. It's not scarcity. It's a very strategic move toward interdependence and autonomy that allows our islands to safely shift away from the type of Western consumerism that's killed Guam's self-reliance or our ability for self-reliance. Obviously it's not killed off our entire ability for self-sustaining economies. What we're seeing in Guam is that right now, if you look at the communities and villages that are doing really well, it's the farmers and the fishermen that are helping feed our community right now. And I'm really inspired by that because it means that we have a vision for a model forward. Scarcity doesn't have to be a weakness if it forces a people to develop self-sustaining economies and self-sustaining social systems. So the main idea here is that Palau's sovereignty in this crisis has looked like leveraging their diplomatic relationships with allies without compromising their specific community needs, and continually pushing their people towards sustainable economic systems outside of tourism. So yeah, I feel like we can learn a lot from our Micronesian neighbors, and I think the inclination to always say like the West is best and the American ideal is the only standard that we should live by. What we're seeing right now in this crisis as Pacific Islanders, as Micronesians, that's not necessarily true. And we should be looking at how our brothers and sisters in other islands are maybe better set up to deal with this crisis. And I think Palau has set a really great example of what sovereignty can look like on our scale, because I think we have to realize, like what Fran highlighted too, is that Guam isn't a state, and so we shouldn't be looking and addressing our issues the same way as this like blanket version that we're given by America, because at the end of the day, like our islands are a very specific context, and we should be looking for examples from our context in Micronesia. But yeah, that's pretty much all I wanted to present on. Thank you so much for listening in. And yeah.
Viva, Sizos, Maasi, Shaban. We absolutely can see how the Marianas being the only part of Micronesia with positive cases really is limited in this time, as both you and Fran have shared. And we want to think beyond that, beyond this moment, and imagine from all these lessons we're learning from COVID about the ways in which our political status limit us, in being able to care for the health and well-being of our community, we really have to begin to imagine something better for ourselves. And so we always sort of end our General Assembly by engaging in a dialogue with the community that attends. And so we typically go into small groups and enter into small group discussions about the topic. But since we are now online, we really are looking to all of you to type in the comment section, or if you'd like to send a private message with any questions or thoughts that you'd like to share. In guiding this conversation, we want to remember that Guåhan means we have, and that first and foremost, we have to believe in ourselves and really understand that anything is possible within our community, as history has shown. And so these are just a couple images of how we normally have these small group discussions at our General Assembly, and an inspirational image from one of our concerts. And before we get into the questions, I just wanted to point out that we always have our General Assemblies on the last Thursday of the month. So the next one will be on May 28th. And we're assuming that people are still only going back out into the community will be slow, and so we don't imagine being fully open by May 28th, and so we'll likely see all of you again online. And so I'm going to stop the share of the PowerPoint and just open it up for our panelists to respond to some of the really interesting questions that have already come in, beginning with the first one about our Maga'taotao, Amanda Shelton. The question is, what was it like for women in Amanda Shelton's position at that time? Women in the States couldn't vote, and most Chamorro women weren't working. I can see her and others as being significant historically for many reasons. So Senator Shelton, would you like to talk a little bit more about the role of women during your grandmother's time?
Sure, thank you. I think something when I was, reading through all the stories of her life, something that really was ingrained in me was that women during this time didn't have careers. They didn't work outside of the home, and that's why her parents, my grandmother's parents, were so hesitant to let her go into the nurse training program. And so I'm sure that was definitely difficult for her, but that was kind of breaking through to show women that careers were possible. And nursing and pateras, midwives, were kind of the first careers for women in Guam, as I understand it. And I think that though breaking into the career was difficult, people very quickly saw the value in her work and in her training and the position that they had. And many people looked to her for advice and for help in her community, even after she was, no longer a nurse. But I can imagine for that group of women that they were extremely valued and looked up to because they were so needed during that time.
Thank you so much. The next question we have is, I used to think that independence was possible for Guam, or at least wouldn't be that bad. But after seeing how badly the governor and her people have handled this lockdown and the release of federal funds, I don't think we are ready to handle our own government. Is this a question you'd like to address, Dr. Napolty, based on your presentation?
Sure. Actually, thank you for that question. I think when it comes to independence, that's a very common sentiment, in that it's really hard for us to imagine what an independent Guåhan would look like, because it takes a lot of, it's a really flexible, imaginative exercise in that you could handle it in many different ways. Like, independence could look like so many different nations. And so for us, because Guam will be, when we decide to vote, Guam ends up becoming independent, Guam will be one of the newest nations on the block, and we'll have the ability to learn from what other nations are doing. In regards to the pandemic, it's hard to, political status is so important in terms of this conversation, because what we're finding is that political status really does kind of change the way that we respond to something. So as I mentioned earlier with unemployment, as I mentioned with mass testing and with the stimulus checks, what we're finding is that the United States may have that money available to us, but because we're a territory, it's making it very hard for that money to get distributed. It's not something that our local government is doing wrong. It's the federal regulation, and the federal government is making it hard for our local government to do something. If we were independent, we would have already had these offices in place. We would have had an unemployment office in place. And the reason I say that is because what I had said earlier, we understand that Guam has a very high poverty rate rather. And so our people tend to hurt because a lot of us fall under the lower economic scale. And so as a result, I feel that independence, we would already kind of have some sort of plan in place to make sure that those people get addressed. I mean, we see that many of us have to go on federal assistance programs like SNAP and welfare. I mean, I worked there for quite a bit of time, and what we were seeing is that a lot of people, they were hurting. This is money they needed immediately. And so because we're a territory, we're not able to give stimulus funding and funding from the CARES Act immediately because we just can't. We first have to deal with the federal government, and then the local government can respond.
Awesome, thank you. The next question we have is about Palau. How relevant is the comparison between Guam and Palau when Palau is much smaller and has a lower level of economy? Siobhan, would you like to answer that question?
Yeah, sure. So I think it's important, right? Obviously, the comparison is going to be really different because Palau is an island of 20,000 and Guam is an island of 170,000. Palau is very homogenous in that it's mostly Palauans living there. And so a lot of times the ease of their implementation of laws and policies is because of their scale. And they have a lot of that acting independent even without the political structures needed for that. Now, the reason why the comparison is still necessary is because the mechanisms that allow Palau to act in ways that are best for their people, those mechanisms are available to us. We just can't pursue them. And specifically talking about food security and self-sustaining economies, obviously I'm not expecting Guam to go, like when we talk about sovereignty and independence, we're not saying Guam is going to, the moment we reach political status change, we're going to all go back to subsistence cultures. That's not what that means. It does mean, though, that if we have, if we already have, even at our best, right? In 2015, the unemployment rate on Guam was at like 7%, I believe, and 1 in 3.4 Guam residents still qualified for food stamps. If the wages haven't risen, right? If Guam's full codependence on the American dollar and the American market system and military and tourism being the two kind of like pillars that we've been presented as our only, viable economies, if those things have not radically improved the quality of life for the most poor on this island, we need to ask questions of what other ways of living are we not investing in as a collective? Self-sustaining economies and renewable economies, whether that's renewable energy, like Palau implementing that into their island, or whether it's food security, like what Guåhan Sustainable Culture and Farm to Table and many farmers who have been organizing on Guam specifically through this crisis to help feed families. Looking at, okay, and let's take those people as examples, because there are people on Guam that have been thinking about self-sustaining economies for a long time already, and what that would look like on a larger scale and how that would help our island. If you look at who's been coming together to organize for our people, it's not the federal government. Those checks haven't come in yet. It's local community members from different villages organizing on a small scale to support each other. What I'm saying is that those are the systems that need to be invested in and be used as the model once we get out of this crisis. Because to me, what this crisis is exposing is that the models that we rely on, they're not working. They haven't been working for the most poor in our island. But now there's this great leveling where everybody in our island is kind of facing maybe a reality that they could ignore before this. But hopefully, if you're home and you're watching this and you're seeing what it's like to be hungry and for what it's like to not have money, what it's like for the federal government to not come to our rescue when we need them to, that should cause great concern, but also great hope that change is necessary. And it's already happening. And our community is responding in ways that maybe was easy to overlook. But it's our farmers and our fishermen that are feeding our families right now. It's DOE teachers, going unpaid, volunteering to, feed people. So when I talk about self-sustenance and models of, model nations, I'm not saying that Guam should, look at Palau and then follow everything they did by the book. I'm saying that we should start thinking in a more independent way as a people, that you don't have to wait for political status change in order to start investing in your people. Yeah.
Thank you. That was really powerful. Thank you for those comments. Our next question is sort of related in an interesting way. It is, what are the Surahanas and traditional healers saying about the virus? What would they say we should do? And so, again, looking at alternatives, would anyone like to talk a little bit about how traditional healing plays a role during this time? I mean, I can imagine that, knowing what I do know about our omelet and our plants that grow here naturally and are endemic to our island, is that they could help to heal the symptoms of COVID, and that using traditional medicine has always been an important practice, especially dealing with respiratory issues or dealing with just general health and well-being. And so I imagine that always really knowing that our traditional healers have wisdom and answers that are thousands of years to heal and sustain our community is still relevant now, and especially moving into the future. How do we better incorporate the healthy lifestyles of our ancestors that our Surahanas and our ZOMC are aware of into our own lives, so that we are healthier as a community, and when a pandemic like this strikes, that we have these tools to maintain our health with or without COVID. Would anyone else like to add on to that? Okay, so we'll move on to our next question. Should Independent Guåhan change its name to Independent Marianas so that it speaks for more than just Chamorros in Guam? Would anybody like to address that question?
I think in order for us to do that, we would really have to first talk to CNMI. I mean, we are different political entities, so it would be hard to start an independent Marianas movement if we don't kind of unpack the Marianas political status versus Guam's, because they're not a territory. And so for us, we would have to first have that conversation with people in CNMI to first see if even reunification is a conversation they want to be having. I mean, there are people who do want to see that happen one day, but as part of the larger conversation, I feel like we would have to kind of push for that a little bit more in order for us to do so. And so I can't really speak for CNMI, at least in that regard. And so thank you for that question. And hopefully one day we can move towards having those conversations.
Absolutely. And I believe that sovereignty gives us that ability a lot more. And so, as long as Guam's political status is unresolved, it's difficult for us to try to enter into a new political relationship with the CNMI, especially as Fran pointed out, when we aren't in these conversations currently as, two sovereign entities or entities that can actually enter these types of agreements without the United States interference. And, the CNMI went through their own decolonization effort, and they have their covenant, they have their Commonwealth status, which they negotiated with the United States. And so for independent Guåhan to speak on behalf of the people of the CNMI in a way that implies they may desire independence is out of place for us and genuinely tie respect to. And so, while we are interested in maintaining a close relationship with the rest of our family throughout the Marianas, and while we dream of a better political relationship for the entire archipelago that does allow us to be united again as one Chamorro people, until we are really able to exercise our self-determination and be in a position where we can even negotiate with the CNMI, it's very difficult for us to kind of put us all under one umbrella of desiring independence. And this particular organization is really committed to the possibility of independence as a political status option for Guåhan, because that is the sort of pending plebiscite that would happen here. And so I think as we take it step by step, the vision and the hope is that it will actually bring us closer together. But until then, we really don't want to speak for our Manyatlu up north. Okay, the next question, the next two questions actually I'm going to put together. Food security is key. What steps can we take to make it real? And how can a person help promote or live with food sustainability if they don't have land or don't know how to farm? Siobhan, would you like to take that one?
Yeah, sure. Thank you for asking that question, whoever submitted that, because to be honest, I've been thinking about that this entire month, and it's also the question of food security has actually really impacted a lot of the work that I'm currently doing now. To highlight, during this crisis, a lot of farmers and organizers have been really, they've been really responsive to the community and immediately getting people together to help feed food insecure families. So on a very practical level of your question, what steps can we take to make it real? There are people making it real on Guam, but they need support. They need organizational support. They need, so Guåhan sustainability culture, farm to table. There's probably like a bunch I can mention. Programs at UOG that are investing in different innovative ways for agriculture on Guam. Because like that industry exists in Guam, it just hasn't been scaled, I guess, to the size that our community would need. To make it real in your life, not everybody, which is in that second part of the question, how do you help promote or live with food sustainability if you don't have land or you don't know how to farm? That applies to a lot of people, especially if you think about 50% of people on Guam are renters, and you may not even live in a house that has access to even a backyard. So there's been small ways that we've been trying to implement, like home gardening and kind of like self-sustainability in that way on a very individual, familial level. But honestly, I think what our island really needs is a real collective push from business investors and like the government to actually put dollars behind farmers that are already organizing to feed the community, because we can all make individual efforts, to eat local and eat fresh and to kind of, grow our own food and live off the land in that way. But real meaningful change can't happen unless it's addressed systematically. And I think promoting food security begins on a personal level, but it also has to begin in a systematic level. And I'm glad that there are people on Guam that are much more qualified to have that conversation and are having those conversations. So if you want to see what that looks like right now, in terms of like, what does food security look right now in response to COVID-19, you can look at Guåhan's sustainability culture and how different organizations on Guam have created their own links of like, what would be reminiscent of like a production line. Like you have farmers organizing to get food to local restaurants that are organizing to cook the food, that are sending that food to, you know, nonprofits that are distributing, right? Because these are things we have to think about. Like food security is not just as simple as someone growing their own papaya at home and eating it. It's an entire system of from growing it all the way to the production line of distributing it and making sure it gets to people's homes. So when we have this conversation, we have to think like, how do we invest in those people that are already having that conversation for our people? Yeah, sorry, that was kind of a ramble session, but to answer your question, I think it's really possible, and I'm really hopeful because there are a lot of people on Guam that are working really hard to make that a reality for everyone.
Siva, Sizos Masi. Our next question is, does your group have a stance on the administration preventing Chamorros from practicing their religion because of an alleged virus? Isn't this the type of thing that your group should be protesting about? Would anyone like to take that question? My interpretation of the order is actually not that the order itself to stay home is preventing people from practicing their religion. In fact, it was, you know, the largest religion on Guam, for example, the Catholic faith, the Pope decided, and the Archbishop decided to stop masses very early on, and not just because of the governor's order, but because of their own desire to keep their parishioners safe, and have since made accommodations to move masses online. Those masses are either televised through the internet or on actual television. And so, you know, I know for my mother, for example, she watches mass on TV. So a lot of people are still very actively practicing their religion and faith. People have different online prayer groups or prayer chains on their phones and their chats. And so it's been a new way in which people practice their faith together and come together. And I wouldn't say that my interpretation is that the administration has prevented Chamorros from practicing religion. I just know that these religious faiths themselves recognize the danger of this virus and are making their own adjustments during this time. Shaban, did you want to add to that?
No, I just wanted to say that as someone who's in like a leadership position in a really small village church, it's been really important for us to choose not to gather as an act of like compassion, and that like if you're using a spiritual framework to think about our collective actions during this time, if that's the worldview that you're operating from, for us, we actually want to be more proactive than our government. And if we know that our Manamku, if we want to be compassionate to them, if we want to act in love towards them, then doing everything we can to not gather, if that's what's safest and the most loving thing to do. That's what we've been told by our spiritual leaders. So I think that actually, if you think about it from that point of view, like how best can I love my neighbor during this time, since that's what we're being asked to do, then yeah, I wouldn't see it as persecution or even, you know, a removal of my rights. I would see it as a call to action, to lead by example. And if the best way to take care of our elders right now and love them, and not just our elders, but all the people in our community that are most vulnerable to this, is to stay home, if that's what we're being told by, you know, medical professionals, then I think that's an important thing. And I feel like the church has an opportunity to be a leader in that role. And I think like what Victoria said, they are doing that. So yeah, I see it as an opportunity.
Viva, Caesar's Maasi. Our next question is really more of a statement, and I'd like to actually read it and just address it. It says, America is a nation blessed by God, and to speak ill of what is blessed by God means to invite the devil into your home and your island. We should feel blessed to be under the halo of America. And so, this is an interesting statement because one of the leading principles that America has is freedom of speech, and that this is one of the things that America really proclaims to the world, marks it as one of the quote unquote greatest democracies in the world. And so America itself was founded by people who were seeking the exact same things that we seek in our independence movement, the same rights and the same, with the same motivation. And so I believe that, in really thinking about whether or not we should speak about the ways in which our unincorporated territory status limits us, is speaking ill of America, that really opens up a larger conversation about freedom of speech and what America really does stand for. And so my interpretation of America's Constitution and America's sort of identity, or the identity that it proclaims, is that conversations like this are very in line with the principles America was founded on. So I hope that I addressed that somehow, and also to encourage all of us to not, questioning and being critical of any government, especially the government that controls us, is important. It's healthy. It's part of being good citizens and good people who want better, right? Who want to be governed in a way that really doesn't leave anybody out, that doesn't deny people rights. And so, conversations like these don't have to feel like you're sinning or you're inviting the devil into your house, but rather that you're opening up to new possibilities and really seeing sort of the greater world that is around us. And even within our limitations as an unincorporated territory status, we do have the freedom to speak about it. Anyone else want to chime in on that tip? All right, next. What can I say to people who say the movement for decolonization is dead or no one cares? Senator Shelton, would you like to take this question?
Sure, I would say that the movement definitely isn't dead. I mean, we have groups like you and the whole Decolonization Commission who are working towards it. And I can't recall what month that was that you all hosted the Finogi March, but that was an excellent show to say that the movement is not dead. And, from me to another young person, I would say have hope, because there are people who care about it very much, who are working very hard every day to find some kind of resolution. And hopefully it'll be in our lifetime. And the more that you talk about it, the more that you discuss it, the more that you go out and support it, we will continue to make strides.
Awesome, thank you. The next question, it looks like it's a continuation of our conversation about our relationship with the rest of the Marianas. Guåhan Patanti and Nafat Malik. It's not reunification, but unification. We've been separated not by our choosing. It's a rigged decolonization. Why were Guam Chamorros not involved in the discussions about decolonization in the Marianas? I couldn't agree more. And thank you. Yes, imagining not a reunification, but a unification is important. And Nafat Malik is important in these conversations. And ultimately, I think the answer is actually in the heart of that question, is that yes, we were separated not by our choosing. It's your classic case of divide and conquer. The historical traumas and pain that divided our community were the result of decisions made by world powers beyond our shores. So the initial ways in which the Marianas were separated, of course, it began with the Spanish really moving our people around, and through the reduction, and then through the Spanish-American War, where Guam is ceded to the United States, the rest of Micronesia is sold to Germany, and then later sold to Japan. That was really our first big political split with the rest of the Marianas, in a way in which, because Japan had been governing the CNMI, Chamorros from the CNMI were brought to Guam and used by the Japanese as translators and as a police force. And this created a lot of pain between Chamorros from Guam and Chamorros from the CNMI, so that when there were efforts to reunify, as it was called then, there were reunification votes. First Chamorros from Guam said no, or voted no, and then later, and the Chamorros from the Saipan voted yes, and then later, when the CNMI was going through the Commonwealth process, and it was evident that they were going to get a more favorable political status, Chamorros from Guam wanted to vote again, and Chamorros from the CNMI did no longer wanted to reunify. That whole process was the result of not just this political division, but also the traumas of war and things, again, that were imposed upon our islands and our people that divided us and brought pain. But many of us know that that this division between us is political. It's not cultural. It's not familial. Our families are still connected. Our culture is still one and the same. Our language is still one and the same. And so, it is important for us, as you mentioned, to think of Inafat Malik and how, even though these political divisions prevented us from equally being involved in the decolonization processes of both parts of our archipelago, today we should be communicating. In fact, Dr. Babakwa and I are both active members of the Commission on Decolonization, and under the last administration, we had urged Governor Calvo to be more engaged with the CNMI when they opened a political status commission, when they had created one by law. And we continue to urge the commission to engage in dialogue with the CNMI. We recently actually, our last meeting before the shutdown, we actually had someone from Saipan come and appeal to the commission that we work more closely together. And, we had Representative Ogamoro present at our decolonization conference. And so I think that now we are in a place, and there have been efforts where our islands are working together more, but I would like to see our governments working together more. I think that our activists and our community workers are very connected. But I think the more our leaders work together and see ourselves as stronger together, then the more possible unification is into the future. I hope that I responded to that. I'd love to continue the conversation, and we can talk about it coming up soon, because it is very important. The next one is, how can we argue against those who are calling for everything to be opened up and accusing the governor of this and that? I voted for her and support her, but their voices are so loud and angry, and people are listening to them. I think things should stay closed, but I need ammo to argue with. So what are some things, maybe if people in the community are saying we should open up and are very angry, what are some things we may want to think about or consider? What can we say?
I think with Guam, part of the reason why Guam might be a little more cautious is that because we're pretty close to Asia. Like, Asia is where this pandemic started. A lot of its nations got hit really hard. And on top of that, our primary economic engine here is tourism. So that means opening up flights, getting more people coming in. And so, of course, as we saw with nations throughout the world, one of their first lines of defense to this whole pandemic was to shut their borders down. So I think in order for Guam to be able to reopen and resume kind of the life that we had before this COVID-19 crisis, it would mean putting us at much higher risk, because we would have to open the economy in the way that we did before. We would have to open our tourism market. And I don't think anyone's really ready for that. Everyone around the world is talking about reopening, and they're only doing partial reopens. Places in the States are allowing restaurants to open at 50% capacity. They haven't even spoken about what 100% is going to look like. A lot of scholars throughout the world are now saying that they don't think life will look the same, because a lot of us are having to now deal with what they deem the new normal. And on top of that, it's not just the fact that we're really close to Asia, but it's also that we suffer from really high rates of chronic disease. A lot of our people are by far the most immunocompromised. And so if we end up getting a community spread that's very that tends to overload our healthcare infrastructure, I mean, we're going to have a disaster like Italy and like Spain. And so that might be why we're being more cautious. A lot of our people suffer from hypertension and diabetes. A lot of people are asthmatic. And so if any of them get COVID-19, it's not going to be like the common cold. It's not going to be very mild. They're not going to be asymptomatic where they don't show symptoms. A lot of them may need ventilators. A lot of them may need the ICU. And I mean, we're already at the point where Guam Memorial Hospital, I mean, I remember growing up, you would constantly see that newspaper where they were tracking number of beds, and it would constantly be red, right? Because our hospital was so overloaded. And I think we understand that. We understand what it's like to have Guam's healthcare system kind of at its crisis, and we don't want to get there. And so that could be why the island is being cautious, because we don't want to overload our healthcare system. And we also don't want to put our healthcare practitioners at risk. And we don't want to put our people at risk who work in the tourism industry.
Awesome, thank you. So we're just about at time, but we did have a couple more questions. I just wanted to quickly respond to, because it was asking for where to get more information. So what are some of the other families that were known that have nurses before the war, and where could they find information about that? I know Guampedia featured some of our early nurses, including the first chief nurse, Maria Roberto, and our Maga'taotao that we heard about today. But also the UOG Nursing Alumni Association published a book documenting the very first School of Nursing class. And you can try to get a hold of them through the UOG School of Nursing. Also, the Richard Flores Taitano Micronesian Area Research Center, the MARC, has an extensive archive that includes old newspapers and books that look at the nursing profession on Guam. And Senator Shelton, are there any others that you wanted to add where they could find out about?
Oh, sure. I think there's a book about midwives or pateras who lived during this time, and that was, I believe, by Karen Cruz, who's also a nurse. I remember meeting her just a couple of years ago, and she told me that a lot of her research is at the Guam Museum, and I know that she has some publications that I've seen online as well.
Yeah, and Dr. Ann Perez-Hichori's book, Colonial Disease, is also a good source, and that can be found through Amazon. And so, yeah, I just wanted to address that question because it wanted more information. We appreciate all the questions that came in. You know, even if we weren't able to address it here, we hope to continue this conversation. Please reach out to us through our social media networks. You can always email us at independentguahan@gmail.com. And like I said, we'll see you again on the last Thursday of May, which is May 28th at 4 p.m., same place. I want to sincerely thank all of our presenters today for the work they put into their presentations and for your wonderful responses to our community. Sizo Ismaasi, everybody.
Thank you very much, Sis Masi.
Masi.